Hi, y'all.
Hi, y'all.
Well, hey, welcome back. Um, what's been going on with you? Like, let me just give you the floor because you've been gone for a couple of weeks. And because this is going to be, what's the word I want? Spoiler alert. This is going to be the women's healthcare episode. So, what's been going on with you?
Well, I have been busy being completely ignored by doctors and dismissed, and the usual. Anytime a woman gets sick and it's
Oh,
in an area that has those reproductive organs, it's like, yeah, we don't know what it is, but also we're not going to do anything for you, just
oh.
repeatedly over and over again. So,
So, do you still not have a diagnosis?
oh, I have a diagnosis and it is abdominal pain.
No, okay. That's
The
wow.
same one I had 6 months ago and a year
Abdominal
ago. Like,
pain.
and pretty much anytime I go and say, "Hey, something's going on, something's different." And they're just like, "Yeah, but you're always having issues." And it's like, "Well, yeah, but don't you think I know, like, when it's changed and when it's getting more severe or when the location changes?" But yeah, it's, pretty frustrating dealing with healthcare when you are a woman, and I think
Yeah.
all women know that.
Yeah.
And if you've never had to deal with any health issues, I'm sure you have an aunt or a mom or someone that you've watched just frustrating, just, oh, dealing with doctors. Ugh. Even female doctors, like some I used to think like, well, maybe female doctors are a little bit better, and sometimes they are, but then there's other times where it's like, you know, maybe they don't have the same health issues, so they just think that you're over exaggerating
Yeah,
everything.
and I mean, they have the same training. The thing about female doctors is, well, yeah, they all went to the same med school, and the actual medical science itself is so lacking in knowledge of so the reason I'm pausing so much is because I was going to say so lacking in knowledge of the female reproductive system, but so lacking in knowledge of the female body in general, because there's a lot of other things with our bodies that have their own distinct maybe problems or like diseases manifest differently, and they're not actually technically part of our reproductive system, but science is totally oblivious to them because they're in women and women don't get studied. So, like heart attacks have totally different symptoms, or maybe not totally, that maybe that's too strong a word, but heart attacks have different symptoms in women than in men. And the
Right.
heart, in theory, the heart is not, a sexed organ because it's not the uterus, it's not the ovaries, but just the fact that it's in the female body, there's different manifestations. So in pretty much every aspect of the female body, the medical science has just ignored the differences, ignored women, ignored women's bodies. And so women doctors also get that same training. So yeah, I can see where you've had female doctors that you thought would get it and they still don't get it, or they don't, or they, even if they get it, even if they're sympathetic, doesn't mean that they have any answers because medical science doesn't have any answers. So
Yeah, and is even like as as much progress as we've made with like in medicine, it's still amazing that there's so many things that they literally cannot diagnose unless they do surgery,
mm,
because all of our parts are internal. So, you can get, they have ultrasounds and they have CT scans, MRIs, all those things. But because our bodies are so complex and we have so many extra organs in, around our GI area and stuff like that, there's so many things that they literally just cannot see and they won't know
mm,
until they go in and operate. I mean, that's actually happened to me personally. I was having issues with fibroids and none of the scans were showing anything. And they were like, "Are you sure it's really that bad?" Basically, blah, blah, blah. And so they finally agreed to do surgery. And they went in and there was like a giant fibroid that was like almost 14 centimeters. And it's like, how did you not see that on any scans? But that's the thing, we don't have any way of like actually seeing what's
Mm,
going on there. Like it's just as far as we've come in medicine, there's still things that they do not know and they can't see what's going on in there. And it's frustrating because we spend money on all these medical trials and everything, and it's
mhm.
like, what's the point if you're
Yeah.
only going to focus on men?
Yeah.
We know plenty about men. We know
Yeah.
tons about them. Like even, I went to school for medical coding, and it's like I was just astounded, like medical terminology. There's like half the amount of terms for women as there are for men. And like diagnosis codes, like there's like maybe a page of like specific female diagnosis codes, and then you got a whole chapter on men, and it's
Mhm.
so frustrating because it's like we're still in the same boat that we've always been in. And like nobody knows how we operate. Nobody knows anything about our bodies. And
And
it's like I don't know. So it's really frustrating, to hear people say, well, like, oh, life affirming, trans healthcare. Yeah, I'm gonna call bullshit. How about when we actually get actual women taken care of, then we can worry about all the plastic surgery and things like that. I mean, sometimes I feel bad about feeling like that, but it's like,
mhm.
there's half the world is women, and
Yeah.
we literally don't know anything other than we only know that like they can have babies. And I've even read arguments about like in the UK and versus the US, and like there's different positions that they'll put the woman in when she's actually giving birth. And
Oh,
they're
yeah, that's like a whole thing. Like the American on your back, feet in the stirrups thing is a
right,
totally unnatural position that makes
but
birth
it's
harder because the woman and the baby have to fight against gravity when the natural
right.
position is to be squatting, and then gravity helps do the work. Yeah. And the only reason the whole like on your back, feet in the stirrups, think about like who does that advantage? The
The
doctor.
doctor
So the
and
doctor can
only
have
the
a better
doctor.
view. That's it. That's all it advantages. Yeah, but it's almost antagonistic to birth itself because it makes you fight against gravity.
Right.
Yes.
And
Oh my gosh, it's so
that's
crazy.
probably a huge reason why we have like, such a growing interest in women wanting to have home births, or
Hmm.
wanting to have a midwife versus a doctor,
Hmm.
because, most of those professionals actually know, like,
Hmm.
how to handle it and how your body is supposed to be. And they're not going to try to put you in stirrups, they're going to do everything they can to let you do what you need to do to get the baby out. And it's just insane, like how little we know. And even the stuff we do know, it's just ignored because, it's not helpful for the doctor.
Oh yeah, because that's the thing is women, so women who are trained in midwifery, for example, there actually are generations upon generations of knowledge about gestation and birth and delivery that have been passed down through midwifery. But regular people like you and me, we don't know about that because that's not what's the thing that everyone thinks is the best. And well, medicine, treat it like a medical condition, treat pregnancy like a condition that has to be
Hmm.
treated by a doctor, and delivery is like some like akin to like surgery or something. But no, actually, it's just a very natural process for women. And throughout all of the ages, they've been assisted by other women who have those generations of knowledge. But because that knowledge is among women for women, then, medical science comes along and says, no, that's bullshit. We need science and doctors and men in white coats. And it's like, and so now there's been all these modernized, medicalized generation of women since like, I don't know, the 19th century or whatever, us, our mothers, our grandmothers, that then well, now we've lost that body of knowledge unless we intentionally turn back to places like midwifery, doula trainings, whatever. Because now that knowledge isn't just naturally passed from mother to daughter anymore, because now everything, at least in our society, modern post-industrial Western society, everything is just medicalized and it's the domain of men. And so we lost like this whole body of knowledge.
Yeah, and it's kind of weird to me to think about because I mean, I've never had children, but like you shouldn't really need to have a doctor unless there is a problem. Like, I
Right.
mean, obviously if you're, high risk or like something's going on that they perceive like early on or whatever, that makes sense. But like everyone
Right.
needs to go to the hospital, like that doesn't make any, and it's never made sense to me. And but that's where we are.
And I read somebody just kind of an offhand comment, um somebody I guess in the midwife or doula field had said that it's not appropriate to refer to pregnant women as patients because they're not sick. They don't have a disease. Pregnancy is not a disease.
Mhm.
Yeah, and male dominated medical science treats pregnancy like it's a disease that the woman needs to
Right.
be cured of. And the cure is that a man will come in and put her feet in the stirrups and get down there,
Make
eyeball
her
to the
really
skull.
uncomfortable,
Yeah,
fight
and a
everything
man will
her
go and
body's telling her.
save her by delivering her baby for her. I mean, yeah, but it's not really appropriate unless they in fact have some complications and need medical treatment. It's not really appropriate to call pregnant women patients. I've heard that. And I heard that really recently, like in the last 6 months or a year. And I never thought of that before, but I think that's a really good point is that you don't have a disease because you're pregnant. Like,
Right.
yeah.
And I think that's where a lot of the diagnosis codes come from because you can't like bill your insurance company or Medicaid or Medicare. You can't bill anybody, or you can't even really hand the bill to the patient if they're self-pay if there's not a diagnosis. So you have to have
Mm,
a diagnosis, and that's where you end up with things like abdominal pain. Well, it's not really a diagnosis, is
yeah.
it? But
Interesting.
you have to have things in there because like there's going to be tons of stuff that like you said, they're not really technically a patient. They're not ill. They're just pregnant.
Yeah. That's interesting. I didn't think of that. There has to be a diagnosis.
Oh
Yeah.
yeah, there's like, head pain, arm pain, and
Yeah.
it's like and it's all there because there are times when they literally do not know what the heck is going on with you. So they're just like, okay, well, we'll just call it what it is. It's abdominal pain. It's
Yeah.
like, yeah, well,
Which
no
is
shit.
like, well, yeah, abdominal pain is like you could have been punched in the stomach. You could
Right.
have stomach cancer. I mean, it's just so many different things. Um, yeah, I hate to hear that for you. Are you at least feeling better the last week or so?
I'm feeling better. They did find a bacterial infection, so
Hmm.
I think whatever that was really what just kind of pushed me over the edge. Because the pain stuff, it's like I deal with that all the time. Like it's just you just deal with it, and if it's not too bad, you just work through it. But that's I ended up going to the ER because it was like it was changing, and it was like I was nauseated and just not feeling well, just that
Mm-hmm.
general, just your body, and it's like
Yeah.
something is wrong. Like I love to eat, and like I don't want anything to eat, like something is wrong. And it's like, but yep, they just kept focusing on, oh well, she's just here because she's in pain. It's like, no. I'm here because I can't stop throwing up and because, I'm not eating and I haven't eaten in days. But, you keep thinking that like you're just here because you're in pain. So, yeah, whatever. But, they're working on it and I've got about a million follow-up appointments. So
Uh,
hopefully they'll figure out what it is. But yeah, I am feeling better.
so you had told me a while ago actually that your partner, who happens to be a man, not happens to be like you woke up one day and noticed, whoops, oh, actually, he's a man. But yeah,
How did that happen?
that he had abdominal pain several months
Yep.
ago. And so why don't you talk a little bit about what happened when Mr. Man had abdominal pain?
So it was very interesting for both of us. Like he was even shocked. And I was like, I'm telling you, it's always been like this. But I gotta admit, I don't think I'd ever been in an emergency situation like that with another person. So
Mhm.
like that was a really big eye opener. So we went in to the ER and so he basically same symptoms I was having, like only he wasn't even like, vomiting or nauseous. He was nauseated. He was just he just didn't have an appetite and he was having right lower quadrant pain on, in his abdomen.
Mhm.
So, and anytime you have right lower quadrant pain, they say go to the ER. If it's new or changing, go to the ER because, it could be your appendix.
Mhm.
So, so yeah, so we went to the ER and I mean, they immediately put him back and like started giving him morphine and
That is the craziest part. Like
I
they
mean,
immediately, like a man is in pain and they're immediately like, oh,
and
morphine.
an IV of morphine, not
Oh my
even just like
gosh.
a pill. And he was telling them when they were asking, like, what's your pain scale? And like, look, he walked in. He walked in. He didn't have to be wheeled in or anything. He walked in and he's like, well, it's probably about a 5 or a 6 right now on the, scale of one
Mhm.
to 10. 5 or 6, he tells them. And he doesn't ask for anything for pain. He's just like, I just don't feel well. And they just automatically hook him up and give him morphine and start, doing this is like before he's had any scans or anything.
Mhm.
And so they were like thinking it's kidney stones or appendix. So he gets the scan and they see like a little something that doesn't look quite right, but his appendix looks fine. So he's admitted immediately. I mean, like within a few hours, like all of this is happening, just like, and the ER was packed. There was a lot of people there that night. And so, and this had been going on for like probably like almost 2 weeks at that point that he had just been having some weird, weird pain and his just appetite was just kind of up and down, and then it just got to the point where it's like something's wrong. And I ended up telling him, I'm like, we need to take you, like, judging by where your pain is, judging by you not eating, like let's just go.
Yeah, because the
So
appendix thing. Yeah.
yeah, because it's like, and I think most people are aware of that. It's like, oh, on that right side, like, oh, be careful, so so yeah, so they admit him for observation, and then they kept him for a week. And so it turns out that his appendix had slightly ruptured.
Oh,
Um,
how do you
but
slightly? It just had like a
don't,
little leak? Like,
yeah, that's basically what happened. So it had made like, this small area of like, and the body is, always trying to heal itself, like
mhm.
naturally.
Mhm.
Um, so like his white blood count wasn't elevated, like nothing was alarming. It was just, a handful of little tiny things that just weren't adding up.
Mhm.
But still, like even his blood work was fine. It was like no white blood count, no fever, nothing, nothing that would be like, oh, we need to get him admitted. But
Mhm.
they admitted him. And so they're, he stays in the hospital for a week.
On his on his morphine drip.
Morphine the entire time, and they were like giving it to him like clockwork, like every 4 hours. And there was a few times where he was like, I don't need this, like I really, and they were giving antibiotics as well, so that was actually handling the infection that was
Mm.
caused from the his appendix. And yeah, so I mean, like they treated him like a king. Like, it was crazy. And like they still didn't have any firm diagnosis for sure because his appendix actually looked okay on the scans.
Mhm.
So they ended up trying to drain out what was happening, the leak or whatever as they were calling it. um, and the antibiotics had actually cleared it up. So it turns out he actually wasn't deathly sick, and all of that could have been done like outpatient.
Like, just prescribe the antibiotics and bed
Right,
rest and send him home. Yeah.
right, right. And so, okay, so this happened like, a few months ago. And so then I have almost the exact same symptoms, only worse.
Mhm.
And I start freaking out because, I had been recently exposed to a lot of GI doctors who are telling me, like, you have to be careful with appendicitis. There's no like clear cut way that it presents. Like, we always have patients come in that, like, we didn't think that's what it was. And it turns out that's what it was because your body is always going to be trying to heal and fight whatever is happening.
Mm.
So apparently this like, your appendix rupturing without immediately killing you is not that uncommon at
Really?
all. Yeah, it was crazy. So like when I start having like very specific right lower quadrant pain,
Mhm.
and then I'm starting to like, at first I was like, well, it's just my stupid ovary again, because it's always my ovaries or uterus. And I'm like, but no, something's not right. I've never been like sick, like GI sick. So we go to the ER, just
Mhm.
like we
Just
did
like
with
he did?
him.
Yeah.
Only, I mean, I wasn't even physically able to stand. I was so weak and just like my body was just like killing me. Like I just did not have any energy. It was really hard to walk because of the pain. So I actually needed him to push me in a wheelchair because
Mm.
like it was too hard to walk. And so he walks in, gets morphine when he's standing on his 2 feet. I'm wheeled in, and it wasn't even about the pain meds, it was about just the fact that how seriously they were taking him
Mhm.
and how ignored I was being. And if he hadn't have been with me, I think it would have even been a million times worse. Like, so we go into the ER and, they're like, well, it looks like you've always had abdominal pain. And I'm like, yeah, I've always had abdominal pain, but you also see that there's still no diagnosis. And this has been just like gradually getting worse over the past 6 months.
Mhm.
And they're like, well, but you were seeing your gyno, and I'm like, yes, but you do understand that like now I have a fever, I'm throwing up, I'm not eating. Like what?
Yeah.
Like it was just so frustrating to even have conversations with the ER doctors. And so, my partner's like, he had to just step up and be like, look, here's the thing. And he had to tell them all of my symptoms. And then they start taking notes. And
Oh
I'm just
my
like,
gosh.
I
But
could
I
have
believe it.
screamed. If I had the energy, I would have screamed.
I believe it.
So anyway, so my white blood count was really high, and then my platelets were not looking good, and like my liver was starting to do some weird things that it had never done before, and I was sent home.
After one
Sent
night
home.
in the ER,
Yeah,
he got a
yeah,
week.
because yeah.
Yeah.
And so I went home and they didn't prescribe anything. They didn't do anything, even though like, white blood count off the charts, like all these alarming things. Like, and we're talking about like I'm not even just telling you this. This is what the lab is telling you.
Yeah.
Like I can't make that up. I can't just magically make my blood count be crazy. Like
Yeah.
so anyway, so I get sent home and a couple of days later it's just getting worse. So I go back to the ER because I can't get any appointments to be seen immediately. That's not how healthcare works.
No.
In the US, it's like you call
Yeah.
for an appointment, it'll be next year. So yeah, so we went back to the ER and it was the same thing. Well, we don't think it's GI, we think it's gyno. And so the next ER visit, there was actually a gyno on staff that night. So he comes in and he's like, "Well, I don't think it's gyno, I think it's GI." And this was the whole thing. Like the entire night that
Oh,
time was like back and forth, back and forth.
yeah.
And so he asked me, he's like, "Do you want me to ask him for something for pain? Like you really don't look good." And he
Mhm.
was like, he was really getting concerned, like
Mhm.
just he's trying to tell the doctors, like, "I know you don't know her, but I'm telling you, I've known this woman for years. We've lived together for years. Like, I know when something's wrong and something is really wrong with her."
Mhm.
And so they gave me some anti-inflammatory meds, which was like basically Motrin or
Oh my
ibuprofen.
gosh. Yeah.
Yeah. And I mean, I'm like, at one point, I mean, I looked like I was going into labor because I'm like bending over the bed, just like you. Do you ever have like pain where it's like you just like audibly moan, like you can't
Mhm.
hold it back because it's just like you just feel so crappy.
Mhm.
So this is what's happening, and they're like, "Here, we've got you some Motrin." so so basically he had to, and my partner is very like pretty timid and like doesn't get loud or anything, and I for the first time I see him, he gets loud and he's pissed and he's like, "You have to help her, like look at her." Like she doesn't need ibuprofen, we could do that at home, like
Mhm.
look at her. So they finally give me something for the nausea and pain, and so I felt a little bit better. And they do another scan, another ultrasound, and like guess what, they don't really find anything other than the usual, like tons of fibroids and cysts and yada yada yada. And it's like, okay, well, so now what? So they sent me home with antibiotics, and the gyno was like telling me, well, I actually wouldn't take those,
What?
um,
Why?
because sometimes when you do like a urinalysis, sometimes there'll be like you can have skin cells or whatever in there if it's not like a
Mhm.
perfectly clean catch. And so sometimes they'll misdiagnose something like that.
Hmm.
And I'm like, "Yeah, but this is my third urinalysis that's showing that like something's not
Mhm.
right." And also the blood work, which
Yeah.
I couldn't possibly mess up. So like, so yeah, so I went home with antibiotics and still like nothing to really help with the nausea or
Mhm.
anything. And again, the pain, like it sucks, but it's like that wasn't the biggest concern for me. It was that everything, all these new symptoms and like not being able to eat and like not even drinking. Like I just didn't want anything. Um, so then so a few days pass and I'm like, still just not really feeling great. And like, now I've got antibiotics and it's like feeling worse because, antibiotics just suck. So we go back to the ER because it got to the point where I was like physically, I was just crying. Like just I
Mhm.
couldn't stop crying because I was just like, I don't know what's happening, but my body's never done this to me, and I'm getting really freaked the fuck out. So we go back a third time, and yeah, it was basically the same thing, but they did kind of they got me an earlier appointment with a gyno surgery. So that's in February.
That's for exploratory surgery?
Yeah, and that's just like the consultation. So they won't
Oh my
actually
gosh,
do.
it's not to do the exploratory surgery. It's to meet with the
Right,
surgeon, to have a consultation, to schedule the surgery. And the
right,
surgery itself is not to correct anything, it's to explore, to just try to learn what's happening.
right.
Oh my
And
gosh.
that's in February. And so, yeah, so that was the best that they could do, and they tried to, refer me to the, GI department because 'cause I'm like, "I need to know, is this, is this OBGYN? Is this GI? Just I
Mhm.
need to know, like, we've gotta figure this out because, like, I can't, I'm missing so much work, like, I can't do anything like this." And so the ER refers me to the GI department, and the GI department rejects it.
Mm.
It has to come from a primary care, and so
Oh
my
my gosh,
primary
it's so stupid. These stupid
right?
little
All
random
these little
rules.
stupid rules will keep you from actually getting healthcare.
Yeah,
And so it's like, well, who's your primary care? Well, it's my gynecologist. Like, I don't, if I
yeah,
need to go to the doctor for something, I will. But like, most of the time I'm going to the gyno.
yeah.
So then it was like, okay, so they called my gyno and said, "Hey, can you put in a referral for GI?" So he tries and they're like, "No, she needs a regular primary care." And I'm like, "Oh my God, seriously." Like all these doctors are just arguing like, well, it's got to be her ovary. No, it's got to be her intestines. Okay, well, how are we going to figure this out? I don't know because she doesn't have a primary care doctor that's not a
Oh my
gynecologist. It's
gosh.
like, it's just so infuriating. So, yeah, now I've got follow up appointments, but I don't have any appointments. Well, the first one is like in December, and that's with my new primary care. And that's basically where I'm at. It's like something's still wrong. It's not as bad as it was, but like I really think it was because, the infection just kickstarted all this shit.
Mhm.
And there's I know I've told you a little bit, like, there's a lot of cancer in my family. And I'm like, talking to these doctors about like these weird rare cancers, like, on my mom's side. I mean, my mom actually died from glioblastoma, which is, like, not that common of a cancer, and her dad had breast cancer. Like, all these things are, like, you go to any cancer organization site, and they're like, "Hey, if you have any of these
Yeah,
things,
these are big
you
warning signs.
yeah,
Yeah.
you need to be real serious with your doctor and have some talks with him." And it's like, here I am. I'm like, "I'm telling you, like, I've got all these weird things, in my family history, and you guys still are just gonna be like, well, we don't know. We don't know." Like, really? Like, and then I had two different doctors tell me, like, well, you can Google your symptoms and it's always gonna come up cancer. And I'm like,
Oh, but that's not why
"N-
you brought it up. You brought it up because
no,
of family history, not because you
no."
Googled your symptoms. Oh my
Like,
gosh.
why wouldn't I trust, like, the American Cancer Society
Right.
to tell me, like, what things I need to look for? This is not me going to WebMD and, like, putting in my symptoms and it saying cancer. And I
Mhm.
didn't tell you that. I'm telling you that I have gone to multiple cancer organization sites because when my mother was sick with cancer, we needed to know these things. So
Mhm.
I'm very aware of all of these things that I need to like keep on my radar. And I'm
Mhm.
telling you this, and you're just like, oh, well, you don't want to go Google your symptoms. Like, bullshit. Like, it doesn't matter what you say,
Yeah.
they will dismiss it and basically call you stupid to your face.
Yeah, because
Like,
if you go into a doctor's appointment knowing nothing, bring up no points, no questions, and they find something, they're gonna scold you for being uninformed, for
yep.
being like, "Why, oh, really should be more observant about your body. You really should be reading more about your symptoms and be an informed patient so that you can tell the doctor everything and you can ask informed questions." Like yeah, if you don't seek out information, they're going to call you uninformed. If you do seek out information, they love to do that thing like treat you like you're some kind of hippie or something. Like, oh, you can't diagnose yourself. Oh,
Yeah,
yeah,
you are damned if you do, damned if you don't.
yeah.
And oh my God, but this whole situation, like, I just did not realize how bad it was until I watched a male go through the same thing and get treated
so
completely
differently.
differently.
Yeah. So all he has to do is report a little pain and with no proof. I mean, for all they know, he could be a junkie off the street, right? Because
Right.
reporting pain is totally just like you could just be a really good actor and be like, oh, I'm in so much pain and get morphine. Whereas they're like finding the increased white blood cells, you've been
All
there,
these things
you're
that,
throwing up, you
yeah,
can't act your way through throwing up. So, and
you couldn't
no,
see me for all the red
nothing.
flags that
Yeah.
were in front
Yeah.
of me. Yeah, it's pretty insane. And then
Yeah. Big
so
discrepancy.
one of the ER visits, I was in the bathroom and I saw this stupid poster that was like, give me your pronouns. And I just wanted to cry because I was like,
My pronouns
what?
are my uterus is killing me.
Right.
Like,
I am actively dying in the ER are my
yeah.
pronouns. Like, what the hell? Like, uh yeah. And obviously, like, because male and female bodies are so different, there were things that they needed to consider that they didn't have to consider with my partner, like ovarian torsion or
Hmm.
anything like that. I understand that completely, but then that actually like brings up another point in my head that like we really don't need to be changing anything in the medical records with gender, because in an emergency situation, if you're incoherent in any way, that is going to affect your medical care.
Hmm.
Like, I mean, you literally could die if the doctor doesn't actually know what your sex is. And it's not like they have a lot of time to just like, study your body and try to figure out for sure if you're a biological male or biological female. Like they don't have that kind of time. It's the
Yeah.
ER.
Or
Like they
even
need to work fast.
also sometimes you need medical treatment, you are not in front of them. So for example, there was a case, or I want to say in Britain, where a young woman who identified as herself as a man, so she had all of her records changed to male. So
Mm-hmm.
she never received cervical cancer screenings and she died of cervical cancer. And her brother actually published a piece about this and said, if he probably did the pronoun thing because it was his sibling, whom he loved. So he probably said he, but if he had received the cervical screenings, then he could have gotten his cancer diagnosis. But because the system allows you to go in and change, then of course the whole big medical establishment, you're not always in front of them. They don't know you. They're not your brother. So all they have is like software, right? You just have records and records and records, hundreds of thousands of records, and you're just looking for those that say female, and those are the people you want to invite for the pap smears. Well,
Mm-hmm.
if you let people go in and just change those to male, those people do not get the pap smears despite still having cervixes. So it doesn't do anyone a service to just ballpark ignore their medical reality and just be like, "Oh,
Right.
you identify as male? Okay, you don't need pap smears anymore." Like, no, that's not helpful. That's not
That's not
helpful.
how our bodies work.
No.
Yeah, it's one of the many big issues that I have, like with, just be kind, like,
Yeah, it's not kind to let someone die of cervical cancer. I'm sorry.
right,
So that you didn't
right.
hurt her feelings. Like,
And
yeah.
currently, like, I was looking at my medical records in my chart, which is, electronic medical records that almost all, big healthcare systems use. And
Mhm.
it says like it has your sex at birth, I think, and then it has you can change it to whatever your ID says now. Well, in my state, like it's really easy to get your ID changed
Mhm.
to the opposite sex. Like really easy. Like it's like a one-page form that you fill out, and your doctor or therapist just has to write a note saying, yeah,
Mhm.
they identify as a male, they identify as a female, whatever. and that's it. And then you can get your license changed. And so then you can go to, your hospital and tell them, well, here's my new ID that says male or female or whatever, and they can change your record. Like, that is scary to me.
Yeah.
That's terrifying. Like, this has nothing to do with, like, just be kind and, like, don't hurt anybody's feelings or whatever. Like, I don't care about the feelings. I care if people are going to be at risk of getting hurt in the hospital
Yeah.
because the doctors don't know what they are. Like, it
It's
is
like
absolutely vital to know what sex you are in the hospital.
people seem to think, okay, so the gender ideology is constantly scolding everybody who disagrees, or even everybody who just is confused. They're constantly scolding us. Well, sex and gender are different. Okay, so if you accept that sex and gender identity are different, but you should also recognize there are realms in which one or the other is more important. So, for
Right.
example, the reason that they wanted to make it easy to change things like a driver's license is because if you pass very well, like if you're a woman who's been on testosterone for a long time and you have a full beard and you need to um write a check, you're buying, I don't know, trying to think of where you even like write a check and but you used to write a check, you show your ID. Well, like when you buy a big purchase, like you buy a car, right? And you have like your cashier's check and your loan paperwork and all this stuff for your car. And you
Or
show your
even the
ID.
airport.
Right, or your
There
airport. Well, any place where you show your ID that's not a sexed place, it's just a place of business. They didn't want people to have that embarrassment of, oh, you have a full beard, but your ID says female. What's that about? Because it's not anyone's business when you're buying a car or cashing a check or going to the airport, right? Those are not sexed spaces. Our sex doesn't
right.
matter there. So, yeah, if it makes you more comfortable to identify someplace like the used car dealership as a man, go for it. But they have to recognize if they're going to keep insisting gender and sex are different, they're going to have to recognize that sometimes sex is more important. Medically, sex is much more important than how you feel about your gender. It's got to be sex in that case. And there are multiple instances where I'm sorry, sex does need to trump gender identity, and it doesn't just need to be like, oh, gender identity is just it's the end all be all. It's just everything.
Yeah. I hear a lot of arguments about, like, well, you're just being mean, and it's like, no, I'm not being mean. I don't care what people do in their personal life. Live however you want. I really don't care. But what bothers me is we're getting so comfortable with ignoring what our biological sex is, and we're changing the language so much that what is going to happen when younger kids come up and they don't know why it's important? I mean, it's easy
Mm.
enough for a grown adult to be like, oh, yeah, well, it is important. We know this because, well, I've been to the doctor
Right,
before
because
and
we've
I
had things
know.
like medical treatments. Yeah,
Right.
exactly. Yeah,
But,
but you're right,
younger
kids. Yeah.
children coming into the world are just like, I just feel for them because, oh my God, like, they may have no freaking idea why it's important to have the sex that you were actually born as. Like, they have no idea, like,
Right.
why that would be important. They think that it's all just, like, social and when you're younger, are you really thinking about what happens if I'm in a car wreck and I can't speak for
Yeah, because
myself
the
or
young
whatever?
people are always you always have that sense of invincibility.
Right.
And then also you do generally, I mean, not all of them, but generally younger people enjoy better health. And you might not go to the doctor for years because you're like, oh, I'm young, I'm 22, 23, 24. And you just don't bother because you're young and healthy. And so yeah, you don't think those things are important. But as you grow up, you learn that they're very important. They're I'm sorry, they're way more important than like the clothes or the hair or growing a beard or not growing a beard or being a part of, oh, this is how I identify. This is my identity. No, actually your health is much more important than how you're expressing yourself in the world or what other people think of you.
Yeah, I mean, diseases do not care how you identify. They they just don't. Like, that's just not how the world works. Like,
Yeah.
I don't know, it just seems very dangerous to just keep going down this path of, like, just validate everybody, blah, 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 and it's like, yeah, I really don't care what people do in their personal time. What I'm
Yeah.
worried about is, like, what kind of precedent are we setting when we just ignore it all the time, when we
Yeah.
ignore our sexes all the time.
And you look at these, okay, well, there are these discrepancies in care between men and women. There is this dearth of knowledge about women's health care. And you think, okay, well, the solution is, we've gotten better and better at realizing this, doing medical studies, teaching such and such in medical schools. And so the solution to the problem is we just got to keep working on really studying and teaching female healthcare. Well, you know what? That's not what's happening in the medical schools because they're actually trying to get rid of words like man, woman, male, female, and just talk like, oh, we don't know what makes a woman a woman. Um, and I know there are people who will argue with me and say that's not happening. No, it absolutely is happening. There have been multiple pieces published where anonymous medical schools have acted as sources and said, no, this, I'll tell you exactly what they're teaching. They're not, they're teaching gender identity now. They're not teaching that male and sex are organic biological categories anymore. So that whole ideology is going to undo or at least halt the medical advances that we were slowly making in women's healthcare. Like we had just gotten it acknowledged, in this century, in the last 20, maybe 25 years, gotten it acknowledged, like, oh, let's do better studies in women's health. And now they're gonna just totally put the brakes on that, I guess, and talk about people's feelings about their identity. Don't. So like one of these that I read, I was saying like there are multiple pieces that have been written now, kind of trying to shine a light, kind of be whistleblowers, I guess. Maybe that's too strong a word, but try to say this is what is getting taught in American medical schools now. It's gender identity ideology. And I distinctly remember one of the pieces was talking about they did like this very brief part of their gynecological rotation, maybe just like a day or something. A very, very, very brief part was about, like, for lack of a better word, geriatric gynecology. So postmenopausal. So aging women, they have their own distinct gynecological needs. There's a lot of changes during and after menopause, and a lot of changes just in age that are going to affect your reproductive system. And so talking about this very cursory attention that was given to genealogical or to geriatric gynecology, but then like a week or two spent on like trans women's gynecology, which is like just a reminder for our viewers, a trans woman is a male. That's the person. I know it sounds like opposite if you're not acquainted with the preferred nomenclature, but the trans woman, that's the dudes who identify as women. So why would they even need gynecological care? They
With
literally
no
don't. They
cervix,
have no
no
cervix, they have no
uterus, no
uterus, they have no
ovaries,
ovaries.
no vulva, none of
And
that.
then people who are like, oh, but they can get the vagina. No, they can have surgeries that create a permanent open space in their skin. That is not a
That
vagina.
resembles vulva, but it's not the vagina, which
Not
is a
a yeah.
crazy, insane thing when you think about it. It's like
Yeah.
full of muscles and like nerve endings, and like, I mean, it's built to
Yeah.
house a baby.
Yeah. And it's like the little like pseudo vaginas that they get made through cosmetic surgeries is not the same kind of tissue like at the cellular level. It's
Mhm.
not constructed the same because it doesn't go anywhere. It's like it's like a cul-de-sac. It's not en route. It's not en route to the uterus. It doesn't do anything because it it doesn't have the, like you were saying, the muscles and the nerve endings that contribute to like sexual pleasure, and it doesn't have the muscles or serve the purpose of like expelling the uterine lining or passing the baby. So it doesn't do anything. So functionally, it doesn't do anything.
It doesn't
Structurally,
lubricate itself.
yeah, it doesn't lubricate. So structurally, cellular at the cellular level, and functionally is not a vagina. It's a hole. It's a hole. That's all it is. Um, why would that need gynecological care? Now, it needs care. I'm not gonna deny that, okay, you've had this very specialized cosmetic surgery. And yeah, you deserve specialized medical care to keep it healthy. But that should be a thing that some people want to train in and learn about and treat that. That's not a part of gynecology. Gynecology is for the female reproductive system. The gyno is the word for woman. Gynecology means women's healthcare. It is for the women's reproductive system. Yeah, so there's a long, 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 long way of saying that in one of those articles I had read from the medical student, she was talking about doing rotations and how this like tiny amount of space was devoted to postmenopausal gynecology, and much more space was devoted to men who present as women. And that's so blatantly unfair. It doesn't even, like, it goes without saying how.
Wasn't there even, I feel like it may have been with the COVID vaccine, but I'm not 100% sure. But there was they were trying to say like, look, we did this drug trial and like we included women, but then
Oh
like
no,
come to find out
I know
it
what you're
was
talking about.
actually trans women.
No, it was an HIV drug. It
Oh,
was an
that's what it
HIV
was.
drug, and it was, I'll tell you, I'm like 90% certain, even I know the company, it was Gilead. Gilead Pharmaceuticals had tried and failed, but had tried to get FDA approval for this study and be like, oh, see, yeah, we're good to go. And the FDA was like, no, 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 no. You didn't try this on women. You try trans women don't count. So thank God the FDA was like, no, 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 you have to do a different study. But Gilead legit tried to do it. They tried to pass it off. So
And
because
that's
it's,
just going to keep happening. Like the more we push for all this inclusive stuff, like that is just going to keep
oh,
happening.
yeah, that's
It's
what
not
some
going to be the
people
last
want.
time.
Yeah. Yeah, some people want to just say like that any place where it would be appropriate to examine women or have women do such and such, that it's just exactly the same to have trans women involved. And no, it's not. Like, they don't have the,
I
oh
mean, the
man.
whole reason why they like don't like to use women in drug trials is because of menstruation,
Yeah,
because
because of
it
the
changes.
complication. Yeah, because the
Yeah,
menstrual cycle is so complicated. They don't understand it, and it can just really
it can
complicate
mess
your
up a
results.
drug trial really
Right?
easily.
Yeah,
Yeah.
it makes the results really complicated. So wouldn't it be convenient to have a class of women who never had and
Didn't
never
bleed once a
will
month.
menstruate
Yep.
and never have these cyclical changes? And their estrogen level stays exactly the same all the time because it's just a artificially injected estrogen. I mean, it's so ridiculous.
Yeah, they're just pushing women out of healthcare again. Like,
Actually, we like, hello, we just arrived. So
yeah, like we'd been there like 5 minutes.
yeah.
And it's like, yeah, well, by the way,
Oh, I also found out recently, I didn't know this. Not only is there a long history of excluding women from testing, they exclude female animals from animal testing. Like the first phases, for testing things is animals and then you test on humans. The
oh my
animal testing
God,
phase,
I
they
didn't
will,
know that.
there is a bias towards selecting and testing only on male animals because once
Oh,
again, they're less complicated. They don't have things like ovaries spitting out different hormones at different times. So it's easier for them to test on male animals. So at
Oh
every
my
step of
God.
the testing procedure,
And then it's
they
like
just tested on males. Yeah.
everyone's shocked with all the like menstrual changes with the COVID vaccine. It's like
Oh,
you really
yeah.
shouldn't be shocked because they don't pay
Because
attention
they
to women
didn't.
ever.
Yeah, and they didn't test that. And I know I had changes, and the only thing that made me feel better about them is I went on an online message board and was like, hey, this happened. What's going on with other people? And getting messages from other people. And so I think it a lot of played different online message boards, or different ways that women talk to each other. I think women communities, women talking to each other, kind of did their own little mini science and was like, oh, okay, now I'm going to expect, like a delayed cycle, for example, and I'm not going to panic and think I'm pregnant. It's just a COVID shot, but like, fuck, science didn't do that for us. We had to figure it out ourselves,
Right.
what to expect as a normal side effect or a not normal side effect.
Yeah, I was reading about this lady that had been like through menopause and like she was, I don't know, like 65, 70, something like that. And
Mm.
she was just like, I'm bleeding. Like, how
Yeah.
terrifying would that be? Like, you haven't had a period, in years, and all of a sudden it's just like, oh, I'm bleeding. Like,
Yeah.
that is
Yeah, because
terrifying.
it would be a sign of a problem. So you don't know if like, oh, it's just a COVID side effect. It's not a big deal, or like, oh, I have uterine cancer, and so now I'm having
Right.
uterine bleeding. Like you have no idea. Like I'm
And it's like, I know
pregnant
that
with the son
they,
of God. I
right.
don't know.
And I get that they, they just didn't want to discourage anybody from getting the vaccine. Like, okay,
Mm,
that's great, but like, you could have given women a heads up
yeah,
at least.
they didn't
Like,
want to study it. They didn't. No, nope.
yeah.
They don't care.
And now it's like anybody who talks about, the COVID vaccine in particular, it's like anti-vax, anti-vax. And it just frustrates the heck out of me because
Yeah.
it's like, this is a drug that they literally just made.
Yeah.
Like, like just a few days ago. Like, it's like it has not been around forever, like some of the vaccines that we get as children. Like,
Yeah.
you can't just call everybody an anti-vax because they don't trust this one in particular. Like,
Right.
come on.
Yeah. Yeah, and that's one of those things that's like the how we're talking in our first episode about being purple instead of, we're not traditional Democrats or different traditional Republican. Well, maybe we are traditional in the sense of like those two traditional parties don't exist anymore. There's only the extreme versions of the parties
Right.
where the extreme Democrats want to say if you don't believe X, Y, and Z, you're evil and you're alt right and you're Nazi. Yeah, so that's one of those things is like I definitely know people in my workplace that just go around saying things like, oh, people who won't get the vaccine are just stupid, backward, alt-right conservatives. But I know that my friend who is definitely not stupid, backward, alt-right conservative, she hasn't gotten the vaccine and she just has to sit there and listen to people say those kind of things and not she doesn't get to say anything in her defense because that would make her a pariah at work, and it really really bothers her, and I really hate when that happens.
Yeah, that really sucks. And because we're supposed to be, if you're on the left or, you're Democrat or liberal, like your whole thing is like, well, we follow the science, we follow facts and like we like to know that what we're believing in is based on truth and stuff. And then it's like at the same time, you guys are denying that we have two sexes. You're
Yeah,
denying that. It's like I'm kind of losing a little bit of faith
I
in
don't
you
know how
guys
they
right
yeah,
now.
I don't know how they expect Evermore to ever convince anybody that they're the party of science. Why should anybody listen to them about disease transmission, about vaccine safety, about climate change, about I don't know, statistical or economic trends? all of these things that are supposed to be fact-based and science-based, I don't know why they're just like throwing away all credibility. So I don't know
Right.
how they're going to ever call themselves the party of science again,
Yeah.
because science is so abundantly clear that there's two sexes, there's only sperm and eggs. Like,
I
what's
mean, and
the
it's like the easiest of sciences. We're not talking like, physics or anything that's like,
Mm,
really hard to comprehend. It's like it's literally just biology, like the easiest one of all the
it
sciences. Like it's
is.
so easy. Like you can see it with your eyes.
You
Like
can. Any child who has brought home a pet, brought home pets, right?
yep.
Brought home accident and brought home that girl kitty and that boy kitty. Oops. And now we have kittens. Brought home that boy hamster and that girl hamster. Oops. Now we have baby hamsters. Brought home that, that boy rabbit and that girl rabbit. Oops. Now we have baby bunnies. Like, it is observable again and again and again and again.
And most animals, like, they're like humans, like the male species will look a little bit different than the female species. There's like all these cues,
Mhm.
that's like that tell us like how do you procreate? Because that is what life is. Like it is just like how do you procreate? How do we
Yeah.
keep life going? And so it's just mind-boggling to see them just ignore all that and be like, oh no, it's gender and like pronouns and all this, and it's like no, like literally it's how do we keep living? Well, you have
Yeah.
children.
How do you perpetuate a species? And they've spent, a couple of centuries arguing for evolution, right? And
Hmm.
trying to convince conservatives of evolution. Okay, so now you want to turn to them and be like, okay, so tell me, if there's no such, if sex is not a binary, if sex is not real, and sex is something humans invented and then just kind of read it into the animal kingdom, is not really there. We're just reading into it wrong. Then how does evolution work? Like, I don't understand how they think that they can hang on to evolution as an idea and let go of sex. If you're letting go of sex, you're letting go of evolution. Well, because it works together. Because that's, like you said, the whole thing is just about procreating the species. That's just all it is. So
I mean,
I don't
even
get
if
that.
you choose not to have children, which I made that choice a long time ago, it's still like I still acknowledge that, I don't know if it's the meaning of life, but like, the main goal is to, how do you keep
Yeah.
keep your legacy alive, or
Yeah, as a
whatever.
species, yeah, the individual doesn't have to procreate for, for us to say that the goal of the species is procreation. Because, for example,
Right.
if you look at like bees, only the queen bee gets to procreate, and all of her genetic sisters are sterile because it's advantageous to the species for the for like the queen's sisters to contribute to her progeny.
Mhm.
So you can't say like, oh, because the majority of female bees don't procreate, that's not their goal. No, that is their goal. Like, their activities, their social activities are geared around a particular strategy for continuing their species. So you don't need every single individual to try to procreate. It's that, are there strategies for your species to continue? Um, Okay, so I didn't mean to get like pedantic there, but you just saying like, oh, even though you as an individual don't need to procreate, the
Yeah.
human species is doing just fine because there's enough other people who are doing that. It's like when people want to critique like homosexuality and say like, oh, that's not natural because that wouldn't help the species. No, that doesn't matter. Like, there's enough. It's a minority. It's a genetic minority for people to be homosexual. Like, they are literally in the minority in the sense of there are fewer of them. So there's enough straight people who are procreating that the species is not threatened by homosexuality. So that's not an argument against, you know what I'm saying? anyone who wants to
Yeah.
argue against homosexuality by being like, oh, but it's wrong and unnatural because the whole point of the human species is to continue. Well, yeah, it is, and we have people doing that. So
And we're
so
always going to have people doing that. Like,
yeah,
that's always going to be a thing for a lot of people. Like, we're never
so
going to be a shortage of people.
right. So because heterosexuality is in the majority, then the species can allow for individuals not to procreate. I wanted a different word, but we're gonna stick with procreate, I guess. Yeah. So no, you don't need to have a kid. It's fine. I like absolve you or something. We maybe have gone on a little too long and we're maybe made a long video. Because I think it's been a little over an hour now. So maybe we need to wrap up. I'm sorry to hear about all your problems.
Well, I am feeling better and I'm on my way. So, hopefully by the time my appointments, come around, like modern medicine will have gotten
By
better.
the time you have an appointment in the American medical system, there will
We got like 6 months to work on stuff. Like,
yeah.
I'm hopeful.
You get an appointment and they're like, well, congratulations. We've now concluded 10 years worth of exhaustive studies. And you're like, great, just in time for my retirement.
We just figured out all of women's diagnosis, all of them. We've got it.
We're just not allowed to call it that. We have to call it diagnoses for uterus holders, uterus owners.
Yeah.
Oh, everything's so stupid. Let's let our viewers go and then you and I will continue to talk.
All right.
So if anyone listened, all 27 of you out there, thanks for listening. And we're going to try to do this more regularly in the future. But for now, we're going to say bye, y'all.
Bye, y'all.